This unit is about exposure and technique errors because how we use those techniques and exposure settings will determine how diagnostic a film is. And again, we need that diagnostic radiograph in order to properly treatment plan for a patient. So we're going to start here with the exposure errors. And the first exposure error is that the receptor was not exposed to radiation. This picture isn't necessarily a good representation because it may have a slightly blue hue to it, but regardless, the film appears clear. The film appears clear. So what caused it? Maybe the x-ray machine wasn't turned on, there could have been an electrical failure or any kind of function with the x-ray machine. So to prevent this from happening, you make sure that the machine is plugged in and that it's properly tested to know that it's working properly. The next exposure error is a dark film, which is exposed to white light. If a film comes out completely black, that means it was exposed to white light, whether it was accidentally or maybe there was an error somewhere. So make sure that to prevent this from happening, always protect the film. Do not unwrap it in a room with a white light leak. Safety lights should always be checked, and always turn off all lights in the dark room except for that safe light before you unwrap the film. Then we have a film with excessive exposure time or an overexposed film. So this film is going to appear darker. And this is from too much exposure time. Maybe your kilovoltage was too high or your MA was too high, or a combination of any one of these things. So to prevent this from happening, always check those settings before you expose the film. If needed, reduce your exposure time, KVP, or your MA. And then we have your inadequate exposure time or an underexposed film. This is basically the exact opposite of what we just said. So it means that you didn't have enough exposure time, enough KVP, kilovoltage, enough MA, or a combination of any of these. So again, just check your settings and increase these settings as needed. Moving on to our technique errors. Film placement is very, very important. No matter what technique you're using, film placement is very important. For this particular film, the apex is missing. This is a periapical, but there's no apical portion of the periapical. So this film was not positioned correctly in the patient's mouth to cover that full apical region. So if we are looking for something like an abscess that appears at the bottom of the apex of the tooth, typically, we're not going to see it. So to correct this, make sure that that film is placed so that no more than 1/8 of an inch of the film extends beyond that occlusal surface. Another film placement error that we have is called a dropped corner. And this is when the occlusal plane appears tipped or tilted. So you can see that in this particular one, everything kind of goes at this downward slant, when ideally we would want that film to run sort of straight across or more straight across. So what happened here? The edge of that film, it wasn't parallel with the teeth. So that occlusal plane looks tipped. And to prevent that, you make sure, just take a look before you have that patient closed down completely and make sure that that occlusal surface and the top of that film is parallel. Okay. Then we have some of our angulation errors. This first one is called overlap. And this is an error with our horizontal angulation because our contacts appear on the film. So instead of that beam going straight through the contacts, it's basically cut through the sides of the contacts. So you can see here, there's an overlap. Here, there's an overlap. There. I'm going to start this one over. I don't know if you heard the background noise that I just had there from a visitor, but I'm going to do overlap again. Now we move on to our angulation problems. And this first one is called overlap, and this is an error from improper horizontal angulation. So this is that side to side movement, shaking your head no. And what has happened here, instead of the beam being lined up to go directly through the contacts, it has actually gone basically through the sides of the contacts and superimposing the tooth onto the adjacent tooth. So this white spot here is an overlap. Again, an overlap. I'm just tracing over all of the overlaps here to give you an idea of what they look like. Again, this is improper horizontal angulation. Foreshortening is another angulation error. This is caused by improper vertical angulation. So up and down movement, shaking the head, yes. What appears here is the tooth is foreshortened in this particular instance. What that means is that there was too much vertical angulation. It was in excess or it was too steep. So what happens to the image is it appears much shorter than what they actually are. And then elongation is another or the last angulation error. This is also our vertical angulation. In this case, the teeth appear long and distorted, and this is from not enough or insufficient vertical angulation. So our angulation was flat. Here we have what is called cone cut. This is from improper alignment of the PID. So at the top there, you will see a clear unexposed area. This is because the PID or the tube head was not properly aligned with the film or with the film holder. So the X-ray beam didn't radiate that area. It did not expose that area. And as a result, you have a clear unexposed film in the outline of the PID. So to correct this, you want to make sure that that PID is always properly lined up. This is why the paralleling technique can be such a good thing or have so many advantages, because if you line that PID up correctly with that ring, you won't have cone cut. However, on the opposite side of that, if it drifts at all, if it moves slightly up or slightly down, you can have that cone cut still. So the paralleling technique does not completely solve the problem. Couple things here on improper film placement. So this is a bite wing, and this is supposed to be a premolar bite wing, but the distal of the canine is cut off. So this is not a proper bite wing film. To fix this, you want to make sure that the front of the film or the side of the film that is closest to the midline is lined up with the middle of the canine. That will help ensure that this is the correct placement to have a correct premolar exposure. Another improper film placement, this is for a molar bite wing. So similar as the previous film, that third molar is cut off of this film, so it's improper placement. Your bite wings, you want to capture Your bite wings, you want to capture all of the molars on them as well. So to fix this one, you'll want to line up the front of that film with the midline of the mandibular second premolar. This is a good rule to follow anytime you take a molar bite wing. Even if there's no third molar present, you still want to line it up with the midline of that second premolar. A bent film. You can see if you look in this upper area, see how these teeth are rather distorted? That is because the film was bent, so the image is going to appear kind of stretched and distorted. To fix this, you can use some of the different film holding devices. You can use cotton rolls. There's a couple different ways that you can reposition the film so that it is not bent. And a lot of times this will happen because the way that that palate is curved, especially if it's someone with a shallow palate, you're going to have that bending. Then we also have film creasing. Creasing is going to be different than the bending. In creasing, you see this black line here, and then there's one across the bottom here. That is where the film had been creased. So a thin radiolucent line indicates that the film was probably creased. It causes the emulsion to crack, and that's what causes the line on the processed radiograph. So to fix this, avoid creasing the film. Don't bend it in any way, and gently soften it if you need to place it in the patient's mouth or when you go to place it in the patient's mouth. This is called a phalangioma. So sensitive sometimes. I'm gonna start this one over. This is called a phalangioma. And what we're looking at is this white or radiopaque area right in here. That is what we are referring to. One more time for phalangioma. One more time. This one is called a phalangioma. And what we are referring to is this radiopaque area right here, this little white area. And what that is going to be is the patient's finger. So in this instance, the patient was holding on to the film and then it was exposed. So that's the bone showing up here in the image. So to prevent this from happening, make sure that the patient's finger is placed behind the film, not in front of it. So in this particular case, that patient, their finger was basically up next against the tooth. If they're going to hold the film, which isn't typically recommended, that finger should be behind the film. And next we have a double exposure. You can see two sets of teeth. It's probably the same patient, but two sets of teeth on this film. So this is a double exposure. So the same film was exposed in the patient's mouth twice, two separate areas. To fix this, have a sequence, concentrate on what you're doing, and go in the same order every time so you know the difference between your exposed and your unexposed films, and keep them in separate areas. This is a blurred image. This is from the result of movement. So either the patient moved as the photo was snapped, as the film was exposed, or possibly the PID moved. And lastly, we have a herringbone pattern or a reversed film. So those little dashes, you can see it's a lighter film and there's little dashes at the top there. That's the pattern that they're referring to. And what happened here is the film was placed backwards in the patient's mouth. So then the X-ray beam came in contact with the teeth and then the lead foil backing and then the film, when it should be contact with the teeth, contact with the film, then the lead foil backing. So to fix this, just pay attention to how you're placing the film in the patient's mouth. There is a front and a back to the film, and just make sure you're placing it in the patient's mouth the correct way. So to review, too much angulation results in an image that is A, elongated, B, foreshortened, C, overlapped, or D, none of the above. The correct answer, B, foreshortened. You know if the patient moved during exposure if the film appears A, light, B, dark, C, blurred, or D, none of the above. Correct answer is C, blurred. A double exposure means A, the same film was exposed twice, B, a film was duplicated, C, a film was reversed in the patient's mouth, or D, none of the above. The correct answer, A, the same film was exposed twice. And last, overlap context means the blank was incorrect. A, vertical angulation, B, horizontal angulation, C, both A and B, or D, none of the above. And the correct answer is B, horizontal angulation.